A functional behavior assessment, or an FBA, is a methodology used in applied behavior analysis to determine the function or the purpose or the why the behavior is occurring. The functional behavior assessment looks at it in two different parts. One, through the indirect assessments. Indirect assessments could include rating scales, questionnaires, interviews, and also it can look at reports. Those reports can be from educational reports, they could include day program reports, they can include medical or other historical reports about the individual. The second aspect of the functional behavior assessment looks at a descriptive assessment. Within the descriptive assessment, we're looking at the behavior as it's naturally occurring without any manipulation to those conditions. One way is through antecedent behavior or consequence data collection forms, otherwise known as ABC data collection. The second could be scatter plots, again, tracking the behavior and identifying when it's occurring. And the third within that descriptive assessment is the direct observation. That is seeing the behavior, again, as it's naturally occurring in that time and space. From there, the behavior analysis then looks at the information that's gathered and looks at the patterns that have been identified to form the best hypothesis of why the behavior is occurring. That then helps to inform ways and using the least restrictive methodologies to help reduce those problem behaviors. Based on the functional behavior assessment, the information that's revealed through the history of the individual's reports, the observations, and or any other data that's collected gives an understanding to the frequency, the intensity, or the magnitude or the severity of the behavior and also its duration. Based on that information, the next step to the assessment is to understand what the level of the severity of the problem behavior it is. For example, a level 1 of type of behavior would involve something of a lower frequency, happening only on certain occasions, minor disruptions to the day program or the context to which it's occurring, as well as the severity not really causing too much harm, but enough where the assessment was warranted. The second level usually involves behaviors that happen a little bit more frequently. There's usually a disruption to the instruction or to the rest of the context, as well as the magnitude is having some impacts on the person's day-to-day functioning, day-to-day interactions, day-to-day access to different environments. It's the level 1 and 2 of those types of behaviors that give rise to capacity building. Capacity building, otherwise known as skill building. In capacity training, we are training different individuals, different professionals, different people who are expected to change the environment in some way in order to eliminate, minimize, or neutralize the behavior. Coming back to the functional behavior assessment, those level 3 behaviors, though, are often when in the functional behavior assessment, there's non-conclusive results. That means there's not a clear pattern of what is causing the onset or the function to those behaviors or the why to the behaviors. That is, they're happening so frequent, they're happening at such an alarming rate, and they're causing such a severity that it requires a certified behavior analyst and a team to look at all of the patterns that are happening around the individual, as well as some other aspects that might be happening, including setting events, medical changes, hormonal changes, environmental changes, or care providing changes.
Let's continue to chat a little bit about behavioral terms. So let's focus on some of the plans. First, they go by many different names, which vary depending on where you live and the funding sources and the monitoring organizations. In my opinion, the names don't matter so much. It's what's included in the plans that matters. So let's quickly go through what each plan is about. Skill building plans. So these can be relatively straightforward or more complicated depending on the skills targeted. The plan could focus on developing communication skills, health and safety skills, functional life skills, academic, vocational skills, and if you get the idea. And it typically includes a description of the skill, why it's important, a definition of the goals, the context in which the skill should be performed, how progress will be measured, and the methods used to teach the skill, either in its entirety or it broken down into stages. And often these skill plans are standalone documents that aren't usually involved specifically with addressing challenging or dangerous behavior. Positive behavior support plans. This terminology is used by a philosophy of applied behavior analysis called, shockingly, positive behavior supports, which focus on the overall quality of life and the social context in which behavior occurs. Again, in my opinion, positive behavior support plan and a behavior support plan are equivalent. They're just called different things. Briefly, the plan's purpose is to improve the quality of life of the individual it seeks to support. Generally, the plan will describe the results of an assessment, a brief background of the individual, including diagnoses, biopsychosocial histories, their likes, dislikes, strengths, sensory sensitivity, communication, social and emotional regulation skills, medication, and challenging behaviors. It then sets out strategies to modify the physical environment and support approaches to match the capacities and preferences of the individual. It also builds predictability, choice, and preferred activities into the person's life, and will outline strategies to teach the individual desirable behaviors that allow the individual to access the things they want or need rather than engaging in challenging behavior. And we sometimes call these replacement behaviors. Finally, it does need to include planned responses to challenging behaviors to create a situation in which the individual's wants and needs are more easily achieved through the use of their new replacement behaviors or these new skills rather than the challenging behavior. And without this piece, you really run the risk of the new replacement behaviors not being picked up and used by the individual because their well-practiced challenging behaviors are still completely effective. The plan will also outline monitoring requirements, training for supports, and informed consent. Overall, the takeaway is that this plan, both behavior support plans and positive behavior support plans, are essentially a package of intervention that is 80 to 90% focused on preventing challenging behavior. So next up, we have safety plans, crisis plans, and de-escalation plans. These plans are all very similar in that they focus mainly on managing challenging behavior when it does occur. It typically involves some sort of framework beyond just applied behavior analysis. So things like the MANT training, nonviolent crisis intervention, safe management, understanding and managing aggressive behavior. There's a ton of other different crisis training programs out there. But the plans do typically include a description of the dangerous and unsafe behavior, as well as precursors to those behaviors, including a description of the situation that often occasions dangerous and unsafe behavior. The plan usually goes on to then divide behaviors into kind of a progressive pattern of escalation, sometimes called the crisis cycle, and describes the response that supports and caregivers should give to help de-escalate the situation through both verbal and non-verbal techniques. And the aim is to keep the individual and their supports safe. I think one of the unfortunate realities of how services are allocated is that people in crisis get services first. And so we will often see a safety plan being developed before a functional behavior assessment is complete, just because of the risks to the individual and their supports. But safety planning should never be the end. And the reason is that it doesn't actually get at the root of the problem and try and address challenging behavior in a proactive way. It just really is focused on managing crisis situations. As I mentioned earlier, funding sources or agencies responsible for monitoring services will sometimes determine the name of plans. So just as a quick example, Community Living British Columbia has designated safety plans and de-escalation plans as two distinct types of plans, with safety plans including restrictive practices that require additional approval and monitoring, compared to de-escalation plans, which do not include restrictive practices, and the approval process is a lot simpler. Moving on from plans, we have terms that are used to refer to people, professionals who are providing behavior services. So there's a lot of different names for providers, like behavior consultant, behavior therapist, behavior interventionist, behavior analyst, board certified behavior analyst, board certified assistant behavior analyst, registered behavior technicians, and it can all be a little bit confusing. Many professionals who offer behavior services kind of use these titles interchangeably. I will say that behavior consultant, behavior therapist, behavior interventionist, these are all unprotected titles, meaning that anyone can use that title regardless of their education or their experience. On the other hand, board certified behavior analysts, board certified assistant behavior analyst, and registered behavior technicians are protected terms, and they vary in their level of education and supervision. But all of them are accountable to an organization called the Behavior Analyst Certification Board, which is ultimately responsible for overseeing credentials, continued education, and that their professionals are abiding by an ethical code. So for instance, a BCBA is required to have a master's level education, 2,000 supervised hours, and complete 32 hours of continuing education every 2 years, and they're bound by a code of ethics. Capacity training is a whole other can of worms. So you have agencies that have put select staff through capacity training, which means that they've had some coursework and oversight from other behavior consultants, but it requires no formal education or formal supervision. A note that the broader agency itself is not capacity trained to conduct assessments or write plans. It applies to specific staff within the agency. And if these staff move on, the agency should not continue completing their own assessments and plans. I have some personal opinions on capacity training. Happy to chat about that offline. But I will say that it is absolutely not appropriate for supporting individuals with critical and unsafe behavior. Lastly, just as an aside, this comes up and people are just unsure what it is. RASP list is a British Columbia thing, and it isn't specific to just behavior services. It also applies to occupational therapy, physiotherapy, SLP. And RASP stands for Registered Autism Service Providers. And it's a list of providers with a proven experience providing services to children with autism who are under 6 years of age. And families must use kind of these vetted service providers identified in the RASP list in order to utilize their funding. So I hope this helps kind of clarify some of the terminology. Dr. Poundsamy pushed really hard to have this slide included, so I hope that you all find it helpful.